Hello, I'm Hannah Solito, skin healing expert. Now, lots of my patients are new mums or mums to be, so the subject of pregnancy and skincare arises a lot. And actually, the old school way of thinking suggested that the mother's body goes into a state of natural immune system suppression during pregnancy to stop the mother rejecting the fetus. But last year, Dr. Bryce Gordelier and his team from California University came up with a theory that suggested this might not actually be such a linear process, and that we've actually got a whole roller coaster of events going on during pregnancy and childbirth. So as the embryo is implanting itself, the body goes into a state of acute inflammation. The same kind of process that you might see if you experience a burn or a wound on the surface of the skin. And this is to ensure that the embryo can implant correctly. After that, for a subsequent 15 weeks, Dr. Gordelier suggested that the body does indeed go into a state of natural suppression. And this is because the embryo is releasing cells from the father into the mother's womb, and it's the body's way of ensuring the embryo is not rejected. And then we see that acute inflammatory response arise again just before childbirth to ensure that the mother can give birth. So as you can see, it's not this linear process of suppression. There's actually this whole roller coaster of events going on. And this would explain why certain skin conditions can flare and wane throughout pregnancy and childbirth. Now, what I find even more interesting is that Dr. Gordelier's team suggested that the gut's microbiome plays an absolutely crucial role in this entire process. And as you know, it's the gut that I believe is the underlying trigger for the symptoms we see on the surface of the skin. So in real terms, what can we do about this during pregnancy and after childbirth? Well, looking after the gut is more important than ever. So a diet full of good bacteria such as fermented foods, tempeh, kefir can be super beneficial. But gut bacteria and the microbiome is also affected by things such as sleep and stress levels. And I know that during childbirth and once a mother's given birth and even throughout pregnancy, these things can be really difficult to keep at a steady level. So sleep is more important than ever, perhaps practicing meditation, which has been shown to have amazing beneficial impacts on the gut microbiome. I would also highly recommend a good multi-strain biotic. There's one that we offer on the website. And for more tips, for more information, and for my free pregnancy and post-pregnancy skincare guide, just go to the text, click on the link and download your copy.